All right, so let's bring in health activist Dr. Kgosi Letlape to weigh in on the developments regarding the cholera outbreak in the country to date. A very good afternoon to you, Dr. Kgosi. Thanks for your time with us here on the SABC.
Good afternoon to you and to the viewers.
Dr. Kgosi, perhaps we can look at what's transpired to date and looking at the spread of the outbreak. What is your view on how government is responding to the situation, perhaps as we speak?
I think the government is doing the best that it can, and we should be grateful that the number of cases are coming down. We should just remain concerned that the source of the outbreak has still not been clearly identified. And we should continue in the communities to take precautionary actions of boiling water before we use it, washing our hands, and more importantly, those that have gastrointestinal symptoms, diarrhea, stomach aches, etc., should seek early medical attention so that we can reduce the chances of people dying from cholera.
Speaking of what transpired in the country, I mean, Hammanskraal in itself, as we shine a spotlight on the area, has been battling water problems for a while now, with no proper interventions that have been put in place to really protect the people. And I wonder, at this point, who should be taking responsibility for what transpired within that area?
I think we should take responsibility, all of us collectively, for having created a political system that is devoid of accountability. I mean, the problem has been known about the water sources in Hammanskraal for quite a long time. The Human Rights Council has commented on these issues, but there's been no proper action from different local governments that have come in. And there's no accountability for lack of delivery. It's even beyond just the area of water. So we need to usher in a political system that creates accountability so that those that are in charge, the mayors that were in charge, the councillors that were in charge, while the water is deteriorating, the quality of the water is deteriorating to the citizens of Hammanskraal, should be held accountable for the deterioration of the services.
Dr. Kgosi, earlier on you spoke about, tips, awareness as well, perhaps also urging those to seek urgent medical attention should they suspect any symptoms. And I wonder if you could just reiterate what that looks like for everyone rather, on a national level, as we, begin to mitigate against the problem, isolate the issue within the areas that have come to the fore at this point.
I think the key issue is that cholera is a waterborne disease. And we need clean, safe, piped water for all citizens. If it is not piped, it should be delivered to communities. It must be tested, it must be clean, it must be safe. That is essential. That is not a health department responsibility, but it's a local municipal responsibility. National level in terms of Department of Water and Sanitation. 27 years post-democracy, 29 years post-democracy, we should be ashamed that there are communities that don't have access to clean water. If you look at Hammanskraal is within an hour's drive of the economic epicenter of South Africa, that being Johannesburg. It's within Gauteng, and there are challenges even in that area. We should all hang our heads in shame that we have communities that do not have access to clean water at this stage in our democracy.
Dr. Kgosi,
all of us must take collective responsibility. But one of the other issues from society, we need to ensure that we guard against mushrooming informal settlements that have no access to proper services. There should also be a cry for accountability and responsibility from our society, that we should not be going into unserviced lands and creating health hazards for ourselves.
Dr. Kgosi, in conclusion, you speak about accountability. And I just wonder if you have concerns or fears about whether this outbreak might spread into other places, other provinces like the Eastern Cape, where you know, they have water-stricken issues amongst other issues in terms of infrastructure, metros like Nelson Mandela Bay, etc. How would you weigh in on that as we conclude this conversation?
Well, that should be a concern for all of us, not just for people in Gqeberha. Even for me, sitting in the suburbs, I should be concerned. One of the key issues that concerns me is our inability to locate the source of the infection. Because if you can't locate it, you can't stop it. But we should be encouraged by the fact that basic measures of hand washing, boiling our water, would go a long way to preventing the spread of the disease. But all areas where you have municipal failure of delivering safe water should be highlighted. And there should be criminal liability for those that are voted into positions to keep us safe, that are unable to keep us safe.
Dr. Kgosi, thank you for your time with us here on the SABC and weighing rather on the back of the briefing that obviously transpired earlier on today by the Health Minister Dr. Joe Phaahla regarding the cholera outbreak in the country. Dr. Kgosi Letlape is a health activist. We'll leave that conversation there for now.